There is no doubt that a battle with cancer is one of life's greatest challenges. From the moment you are told of the diagnosis, you are confronted with many emotions and questions. At Community Cancer Care, our goals are to help both you and your family understand the facts about your cancer, provide compassionate care, and respect the dignity of all our patients. We strive to replace the fear associated with the word cancer with understanding, acceptance, and hope. Community Cancer Care is a freestanding radiation therapy center with over a decade of commitment in the treatment of cancer patients. Technological advancements in radiation therapy have reduced side effects and improved patient outcomes. Our compassionate staff strives to provide quality care to patients affected by our nation's second most prevalent health issue. Dr. William Bradford is the radiation oncologist who will oversee your radiation therapy at Community Cancer Care. Treatment usually consists of a specific number of treatments given over a specific time. The goal of this treatment is to kill cancer cells without harming the surrounding healthy tissue. More than half of all people with cancer receive some type of radiation therapy. For some cancers, radiation therapy alone is an effective treatment, while other types of cancer respond best to combination treatment. Dr. Bradford leads your medical team at Community Cancer Care. He is a board-certified radiation oncologist and has 19 years of experience. He is a graduate of the University of Louisville and completed his residency at James Graham Cancer Center in Louisville. Other members of your team include a radiation therapist, a certified medical dosimetrist, a board-certified medical physicist, an X-ray technician, and a marketing director. Cancer can occur anywhere in the body and may take many different forms. Only by understanding cancer, we will become better equipped to fight it. More than 60,000 billion cells make up the human body. They are the units that form the tissues which make up our organs, like the liver, heart, and lungs. When the body needs it, our cells split into two and replace those cells that are defective or have come to the end of their lifespan. This makes it possible for our tissues to preserve their shape and their respective functions with the passage of time. Every cell is therefore programmed to multiply and die. This ordered but complex program is controlled by the center of the cell, the nucleus, which contains chromosomes containing many genes made up of DNA. Sometimes, some of these genes undergo a change. The nucleus then sends out abnormal orders and the cell goes wrong. It multiplies uncontrollably and takes on a life of its own. Each new cell produced contains the same defect. The cells proliferate chaotically and form a tumor. This process may be short, but is often long. 10 to 30 years may separate the birth of a first abnormal cell from the appearance of a tumor, about 1 cubic centimeter. The tumor forms many blood vessels in order to survive. These will supply the tumor with oxygen and nutrients, allowing it to live and grow. This is what we call the phenomenon of angiogenesis. The tumor, however, only really becomes dangerous when the cancerous cells begin to invade through the vessels into the adjacent areas and spread to the surrounding organs. These cells can then invade other parts of the body, multiply, and produce new tumors. Metastasis is the term used for this spreading process. But why does a cell become cancerous? There are many factors, and they can exist to different degrees. Factors have been identified such as hereditary genetic anomalies, exposure to some viruses like HIV, hepatitis B, C, and D, and exposure to toxic agents like chemical products, radiation, and the sun. Also, unhealthy behaviors such as the consumption of alcohol and tobacco, or a diet too rich in fat and low in fruit and vegetables can be factors in why a cell may become cancerous. Today, over 25 million people in the world live with cancer. 7 million die from it each year. The disease represents the leading cause of mortality for those under 65. Lung cancer is the most widespread, followed by breast cancer, colorectal, stomach, and prostate cancer. The means to combat cancer do, however, exist. These often complementary treatments are used alone or in combination according to the type of cancer and its status. The goal of the treatments is to make it possible to eliminate the tumor and cure the patient in early stage cancer, or like a chronic disease, to control its development. How is cancer treated? The three main types of cancer treatment are surgery, chemotherapy, and radiation therapy. Surgery is often the first step in the treatment of cancer. Depending on the location of the disease, a specialized surgeon performs an operation to remove the cancer. Chemotherapy is anti-cancer drug therapy given either intravenously or in pill form. A medical oncologist is a cancer specialist who has special training in the safe and effective delivery of chemotherapy. Radiation therapy is a cancer treatment that uses high-powered X-rays to destroy cancerous cells. Once the abnormal cells are injured by radiation, they no longer reproduce and make new cells. Over time, your own natural defense mechanism rids the body of destroyed cancer cells. Your normal cells can also be affected by radiation. However, normal cells have the ability to repair themselves and survive the effects of radiation. Most cancer therapy involves the careful integration of surgery, chemotherapy, and radiation therapy. If you have just received a diagnosis of cancer, your doctor will likely recommend a consultation with a surgeon, medical oncologist, and radiation oncologist prior to deciding upon a final treatment plan. You will begin the radiation therapy treatment process once your doctors decide radiation is needed. The process involves several steps and can be somewhat intimidating. However, the more you learn, the more comfortable you will be with the overall process. And remember to ask questions along the way. All questions are good questions. Radiation treatment uses focused X-rays, which is a form of energy, to destroy cancerous cells, while minimizing exposure to healthy tissue. Radiation damages the DNA in cancer cells, which interrupts their ability to reproduce, causing them to die and the tumor to shrink. Most normal cells, however, have the ability to repair themselves and can more easily recover from the radiation. Your referring physician will initiate the radiation therapy treatment process by requesting an appointment for you with Dr. Bradford, who is a cancer specialist known as a radiation oncologist. At the time of consultation, Dr. Bradford reviews all the medical information about your cancer diagnosis and also performs a physical examination. Afterward, you will meet with him to discuss the need for radiation therapy, as well as what to expect from treatment. At this point, Dr. Bradford and the staff at Community Cancer Care become important members of your team of doctors. During your course of radiation therapy, Dr. Bradford is the one that directs your treatment and tends to your medical needs. Please know that Dr. Bradford, as well as your referring physicians, all work together on your behalf. Once a treatment plan is decided upon, you will go on to the next step in the treatment process, known as the simulation. During the simulation process, Dr. Bradford simulates or plans how to best use radiation for the treatment of your cancer. Under the direction of Dr. Bradford, the therapist will place you in the treatment position on an X-ray table. You will be informed if a custom immobilization device is needed to help you hold perfectly still. The therapist will also place several important marks on your skin that will define the area to be treated with radiation. A CT scan is used in the simulation process. This special X-ray allows Dr. Bradford to see the cancer inside your body. The simulation and X-ray information is used in the next step of the process, known as treatment planning. Once the X-rays are obtained from the simulation process, the complex behind-the-scenes effort of treatment planning begins. Your treatment planning team consists of Dr. Bradford, medical physicist, and dosimetrist. Using state-of-the-art computers and software, the team carefully analyzes various radiation therapy techniques in order to customize a unique plan designed specifically to treat your cancer. Distinguishing between the cancer and the normal organs is very important. Dr. Bradford carefully defines the cancer as well as the organs that surround the cancer with aid of sophisticated treatment planning software. Next, the radiation beams are uniquely shaped in order to focus the radiation directly onto the cancer. The beam arrangement and radiation dose are carefully analyzed on the computer. The overall effect is the precise delivery of radiation to the cancer while minimizing radiation onto the adjacent normal organs. After Dr. Bradford chooses the final plan, the physicists perform special testing to ensure the plan is both safe and accurate. There are several different ways to give radiation therapy. Dr. Bradford determines which type of radiation is best based on your specific type of cancer. The most common form of radiation therapy is known as external beam radiation, which is delivered by a complex machine called a linear accelerator. External beam treatment is painless, and each treatment only lasts for several minutes. A typical course of treatment is given daily, Monday through Friday, for several weeks, depending on the circumstances. The radiation therapist will escort you into the treatment room and help you into the treatment position that was determined at the time of simulation. Additional marks may be placed on your skin to help align the radiation beam. You will be given specific instructions on how to care for these important marks during your treatment course. The therapist will touch up the marks as needed. To ensure accuracy, just prior to the actual treatment, X-rays will be taken while you are in the treatment position to confirm the exact location of the radiation treatment field. These X-rays are compared to the X-rays taken during the simulation process. If there is any discrepancy, your position will be adjusted so as to precisely match your unique treatment plan. The therapist will step out of the treatment room just prior to starting the treatment. A small camera and monitor allow the therapist to observe you through the entire treatment. Once the treatment starts, you will notice the linear accelerator makes a humming noise as it moves around you. The therapist will ask you to hold very still. When the treatment is over, the therapist will assist you from the table. The radiation therapy is completely painless. You will not see or feel the radiation directed at your cancer, and you are not radioactive. Most patients do not feel any differently when it is over each day and are able to drive themselves to and from treatment. Image-guided radiation therapy, or IGRT, is one of the most cutting-edge innovations in fighting cancer. This state-of-the-art technology is unique in a small hometown environment. IGRT combines imaging and treatment capabilities on a single machine. Because tumors move, this new technology allows your doctors to see and track the tumor at the moment of treatment and to make very fine adjustments to your position so as to greatly increase the precision and accuracy of your radiation therapy treatment. IGRT is the most advanced form of radiation therapy currently available, in large part because it is so precise. Knowing exactly where the tumor is allows clinicians to irradiate only the tumor, sparing the surrounding normal tissue. This accuracy results in higher radiation doses to the tumor and thereby the increased likelihood of controlling or eliminating the cancer. With IGRT, the full radiation dose can be delivered in one session or over a course of several treatment sessions. Patients are treated as outpatients and can return home immediately after the procedure. IGRT is well suited to treating tumors virtually anywhere in the body, including those areas that are affected by respiratory motion. It is now being used to treat tumors in the brain, breast, head and neck, lung, liver, prostate, and other areas. Using state-of-the-art imaging, your exact position and that of the tumors is carefully established and tracked before, during, and after treatment. Adjustments can be made to the position of the treatment couch as required so that you are positioned for treatment with sub-millimeter accuracy. IGRT treatments usually take less than 30 minutes. Most of that time is used to ensure that you are accurately positioned. For the most part, you will be alone in the radiotherapy room, but your therapist will be able to see and hear you at all times through intercom and closed-circuit television systems. They will control the accelerator, the imagers, and the treatment couch from outside the room. Your weekly checkup is a very important part of your treatment course. During your treatment, you will see Dr. Bradford on a regular basis. Your checkup is the ideal time to discuss how you are feeling. He will examine you and also prescribe any medicines you may need. You may want to bring a family member with you during your weekly checkup so the doctor can answer any questions they may have. In general, patients tolerate radiation therapy very well. Most will notice mild degree of fatigue and decreased energy. The side effects from radiation are related to the area of the body being treated. For the brain, you may experience some hair loss. For the throat, perhaps a sore throat. The stomach, some nausea or vomiting. The bowel, diarrhea. The mouth, a sore mouth or perhaps a dry mouth. And for the skin, redness, dryness, or peeling. Chemotherapy is often given together with radiation. Some radiation-induced side effects are made worse with the addition of chemotherapy. You can be confident that your team of doctors are experts at anticipating, diagnosing, and treating side effects resulting from radiation and chemotherapy. You are certainly confronted with many emotions and questions at the beginning of the treatment process. At the end of the treatment, you will have a distinct feeling of what is next. The time following treatment is just as important as the treatment itself. The follow-up period is the time to assess the status of your cancer and its response to the treatment. It is also important for your community cancer care team to care for any side effects that may have resulted from the treatment. We work closely with your other cancer doctors to decide when and what type of x-rays and blood tests you may need. Our goal is to help you return to your normal routine as soon as possible. At first, your follow-up visits are usually on a monthly basis. Over time, the frequency of these visits will decrease. It is important that you remember that lifelong follow-up is necessary to make sure that you do not have any problems from your cancer or your treatment. Radiation therapy is very safe. During external beam treatment, the radiation beam is very focused on the cancer so that it does not spread to your entire body. You are not radioactive and do not pose a threat to others. Almost all of the radiation is trapped within the cancer and not spread to those you come in contact with. You can be assured we will provide you and your family with all the information you need about radiation safety. We encourage you, if there are any questions or concerns, ask Dr. Bradford or one of the staff. All questions are good questions. At Community Cancer Care, we hope to make your radiation therapy experience as pleasant as possible by giving you the knowledge needed to help you cope with your cancer and educating you about what you can expect from your treatment. Our commitment is to provide you and your family with a compassionate environment coupled with state-of-the-art cancer care. It is the goal of our entire staff to help you progress from cancer patient to cancer survivor. If you or a loved one has been diagnosed with cancer, please speak with your healthcare provider about receiving radiation therapy at Community Cancer Care, located at 2114 North Jackson Street in Tullahoma, Tennessee, or call 844-HOPE-NOW to schedule a consult.